I support a total of all three of our units. These are vans that have been upfitted for clinical services, and we provide things like immunizations and screening in the community. For those of us working in public health, we're always vigilant. We're always watching and doing our best to prevent and mitigate disease in our community, and it feels like you're fighting an uphill battle.
Across the country, public health departments are beginning to face the effects of deep funding cuts. The Trump administration is pulling back billions of dollars of health spending, including $11 billion of direct funding to state and local health departments. Federal officials say much of that is COVID-era grants that are no longer needed. But the money was approved for all kinds of things, including detection and tracking for other diseases. In this county, in North Carolina, the loss of funding resulted in staff cuts, including employees dedicated to the department's mobile health program.
Our mobile units have really allowed us to get out into the community and reach more people. There's a lot of demand for us to be present in the community, to provide education, to provide vaccines.
But at the end of the day, when you don't have the funding, you can't keep the people employed. So that is hard to see people, really great public health workers. You want to see the work that they're doing continue. But also it creates some uncertainty for the rest of us of, how can we keep this important work going?
What's happening in Mecklenburg is an example of what's happening in many places. And with billions more dollars proposed to be slashed, experts are concerned critical work will be undone.
The governmental public health system, the federal, the state, and the local arm, is the core system that keeps communities safe and healthy and well and thriving in lots of cases. And if any part of that starts to shift, we could see direct and immediate impacts to the health of people on the ground. And those funds.
The cuts could make it harder for health departments to do vital tasks, like responding to outbreaks before they get too big. They also threaten to undermine even routine work.
Nobody wants to go swim in a community pool and come out of it with a rash or a disease from it. Nobody wants to walk out their door and take a fresh breath of air and start wheezing. These are the things that we do behind the scenes.
And so when you talk about partnerships,
oftentimes we get short-term money to deal with whatever the problem of the day is, and then when the problem of the day starts to go away, the money goes away with it. If you pull a resource, then something's not happening. That program was started by the health systems, essentially. I think no one argues that we want government to be as efficient as possible. I think what concerns many of us is if you cut a lot of areas at the same time, what's the sum effect or what's even the exponential effect? We have a lot of emerging health threats. And those that are unknown, there's the question of what's to come. COVID, 5 years ago, COVID wasn't a thing. It went from not being a thing to the third leading cause of death in our community. We have to be prepared, and if we don't have the infrastructure, we can't build it in real time.